to year after the COVID shots.
Happens to the newborns. And, they were already saying safe and effective in April of that year. And women were getting it sooner than that because we were, deeming them immunocompromised, and they were getting to the front of the line in order to get these injections, and even in the Pfizer trials, they didn't enter somebody in the trial knowing they were pregnant, but they had accidental pregnancies. And they knew something had to be. They even presented that yesterday in one of the talks, where men weren't supposed to have intercourse with women if they were in the trials. They knew something was going to be transmissible, potentially. And, now that people are getting the documents from the trials, there were bad outcomes in there. The miscarriage rate was 80% in the Pfizer trials. They knew that. In November of 2021, a non-clinical staff member in my office, my biller, came to me and said, "Dr. Biss, we've had a really large number of miscarriages this month." She said, "We've had 8 miscarriages," which in a practice that delivers, 20 people a month, that's a lot of patients in 1 month. So I went back to January of 2020, and I started, looking at my population and tracking the losses, the miscarriages, the new entry, which would mean, newly pregnant women calling for an appointment, so less than 12 weeks in their pregnancy, and the amount of deliveries in that year. And I was moving forward, tracked until November of 2022. So I had 3 years almost completed of data. And I sent that information to Jessica Rose, and she published it in her Substack. And so it's nice, pretty charts and graphs, etc. And sadly, I noticed that my miscarriage rate from year to year had gone up by 100%.
So do you know what this actually means? We've spoken about people that have died because they got the vaccines, and we're speaking about 17 million plus people that have died. Now, what we actually have not done is to put together the numbers of those that died because of the COVID vaccine shots and the children that died in their mother's wombs. Think about that. If we had 100% increase in miscarriages, and at this point in time, we're not even sure at what point the women would actually miscarry. This is some data that we still need to find out. At what point would they miscarry? Were they already growing fetus in their stomachs? At what point, so that we can ascertain the actual number of deaths? This is really big.